Haya, endelea, anza. Unaona
My
inahesabu.
name is Mary Kani, an ECMO nurse. If you don't have a lung, it is not the end of you. At the current hospital, we have artificial lung for support. Welcome. I'm going to explain to you what is an ECMO. In full, ECMO means extracorporeal membrane oxygenation. We usually do it to support the lungs for patients who have lungs failure, and it can also support the lungs and the heart with different site. The one that supports the lung is called venous, and the one that is supporting the heart, we call it veno-arterial. I will explain at the end of the video details about ECMO, contraindication, investigation to be done, and what we need to monitor for our patient. I hope you'll enjoy the video, and we'll continue to support patients who have lung issues to make them enjoy life again. Thank you. I'll start by explaining what we have here. We need to have a monitor to monitor our pressure and oxygenation of the patient. All about this that you are seeing red, these are tubings of blood, the blood that is coming from the patient and the blood that is going back to the patient after oxygenation. Here I have a monitor with me, and with the monitor we need to monitor the pressures before the blood is being oxygenated and after the blood has passed through the artificial lungs where it has been oxygenated, and the pressure after the oxygenation. The upper part, the upper readings that you are seeing, 285, those are the pre-membrane pressure. And the lower ones, they are post-membrane pressure. And here are the saturation of oxygen in the membranes or our tubings. Here we have some readings. This is what helps us to guide how the blood is going to flow in the tubes. We have something called RPM, rotational pressure per minute, which is 3,902. This rotational blood per minute is the blood that is flowing from the patient to this machine. At how many rotation it is flowing per minute. It has to be high so that we get a good cardiac output. And then here we have LPM. This is our cardiac output. I hope it is clear. So from our rotation pump, we have a tube here that is blue. We have some blue coloration. The tube here is the pre-membrane blood. That is the blood that has not been oxygenated. And the pressure, we remember we mentioned the pressure has to be high because the blood that has low oxygen usually flow slowly. Now here you can see some tubings. This one we'll explain later when we are doing dialysis for this patient, how we connect it. The blue part here, this is our membrane, where the blood is getting oxygenation. At our membrane, we are able to see this tube. This tube is connected to an oxygen source so that the membrane can get oxygenated. After the membrane, we have this red tube. This red tube, the blood is flowing at a low pressure. The pressure that we told you that is 169. After the blood has been oxygenated, and then the blood is taken back to the patient, and the vital organs are able to get oxygenation. It is also important that the blood that is outside the patient, there is risk for coagulation. At top here we have a bag that has heparin and saline that is being infused throughout the tubes to ensure that we don't get a blood clot. I hope you continue. You have enjoyed the video. We shall post later when we are doing dialysis and how we are connecting and how we have to adjust our pressure. Thank you. Continue watching.